Type 3 hypersensitivity reaction characterized by formation of immune complexes in the circulation. Immune complexes get deposited in blood vessels, leading to complement activation and a subsequent cell-sustaining acute inflammation takes place. Inflammatory cell release lysosomal enzyme, generate toxic free radical, causes tissue damage. Complement fixing antibodies, namely IgG, IgM, and occasionally IgE. Antigen may be exogenous, example foreign protein, diphtheria antitoxin, horse antithrombocyte globulin. Endogenous, it may be against cell component in case of autoimmunity, example nucleoprotein against nucleoprotein, example nucleoprotein as seen in case of SLE. Immune complexes can be of two types. Either it will be insoluble complex in case of antibody excess or antigen antibody equivalence, where antigen antibody concentration are equal. Then immune complex formed are large and insoluble, produce localized effect of type 3 hypersensitivity reaction. What happened here is this antigen antibody when react and form the complex, as it's have large volume and insoluble, it gets precipitated at the site of formation, so it produce less or localized if harm to host, or localized produce only localized response. There is a soluble complex antigen in excess, particularly monovalent antigen. Small soluble complexes are formed, which tend to travel through blood, get deposited here and there in various sites, and provide generalized effect of type 3 hypersensitivity reaction. Here is as antigen in excess, mostly in monovalent antigen case. A small soluble complex of antigen antibody are formed, which tend to travel through blood and get deposited in various sites, provide generalized effect of type 3 hypersensitivity reaction. Mechanism of type 3 hypersensitivity reaction. Mainly two mechanisms are followed. Classical complement activation. Here complement byproducts such as C3A and C5A, which are anaphylatoxin and chemoattractant, recruit neutrophil to the site of immune complex deposition. Then neutrophil attempt to phagocytose the large immune complexes, but fail in doing so. Then frustrated phagocytosis. Then frustrated phagocytic cell releasing a large number of lytic enzymes from their secretory granule, and extensive tissue damage takes place. Other mechanism is activation of platelet and platelet aggregation, leading to tissue ischemia and damage. Activation of Hagman factor lead to activation of kinin, which in turn cause vasodilation and edema. This is pictorial view of mechanism of type 3 hypersensitivity reaction. This is a phase first of immune complex. This is phase first, and this phase second, and this is phase third. In this phase first, what happen in phase first, antigen which comes in antigen which come in circulation bind with antibody and formation of antigen antibody complex takes place, and this antigen antibody complex deposit here and there. If this antigen antibody complex is small, then it travel through blood to distant places or various organs. But if antigen antibody complex is large, then it deposit where it formed itself. When antigen antibody complex deposited in blood, here in blood vessels, what happens is complement get activated, and complement produce various cytokine which promote this platelet aggregation and inflammation, and through chemotaxis various inflammatory cell also get come there where immune complex deposited to phagocytose. But as the size of immune complex is greater, it could not phagocytose it, and frustrated phagocytic cell release various lysosomal enzyme and lead to fibrinoid necrosis, which is we can see here clearly. Type 3 hypersensitivity reaction. It may be localized or orthrous reaction, localized area of tissue necrosis due to vasculitis resulting from acute immune complex deposition at the site of inoculation of antigen, as seen during desensitization treatment. In desensitization treatment, we give antigen. During desensitization treatment, if we give antigen subcutaneously at the same place for a longer duration, then chances of localized arthritis reaction is very high. And second condition, farmer's lung or bird fanciers disease, where also called allergic alveolitis, generalized or systemic, have two phases of pathogenesis: formation of small size soluble antigen antibody complex, induce inflammatory reaction, deposition of immune complexes in various tissues. Example: vasculitis, arthritis, glomerulonephritis, as seen in post-streptococcal glomerulonephritis, SLE, rheumatoid arthritis, polyarteritis nodosa, nephrotic syndrome in Plasmodium malariae, Katyama fever in schistosomiasis, and hyperacute graft rejection, dengue arthritis, and hepatitis B or hepatitis C arthritis. These are the example of type 3 hypersensitivity reaction, and it is generalized type of type 3 hypersensitivity reaction, where small immune complex formation and which get transported through blood various organ and get deposited there and produce a generalized or systemic response or thanks for watching.